There we go. Okay. Good morning. My name is Alex, and today I'm going to be doing my demonstrative speech on how to properly check a blood pressure. Okay. Thank you. And here's my volunteer, Kathy. Thank you so much, Kathy. Before I demonstrate how to properly check blood pressure, I'm going to explain what a blood pressure is. Blood pressure is the amount of force that your blood exerts on your arterial walls as your heart beats. There are two types of blood pressure gauges. There is the systolic, which is the top number. That is the amount of force that your blood exerts against your arterial walls as your heart beats. Then there is the diastolic measurement, which is the bottom number. That measures the amount of force your blood exerts against your arterial walls in between beats while your heart is resting. I have a chart right here from the American Heart Association that demonstrates the proper blood pressure ranges. We have normal. Your systolic would be less than 120, and your systolic would be less than 80. You have elevated ranges, which are 120 to 129 systolic, and again, less than 80 for your diastolic. Then we have high blood pressure, which would be hypertension, stage 1, 130 to 139, or 80 over 89. Then there's hypertension stage 2, 140 or higher, and 90 or higher. Then we have a hypertensive crisis. Working in a dialysis center, I see these numbers quite frequently, as hypertension is the number one cause of renal failure. And the numbers for these would be higher than 180 and or higher than 120 for your diastolic. First, we're going to do the easy one. We're going to do a measurement with a automatic blood pressure machine. And so for this, it would be best if your patient takes off any outer layers so we can get as close to the skin as possible. You want to make sure that your cord right here is towards the inner part of their elbow, and you want to make sure that your cuff is tight. Another important thing with taking a blood pressure is posture. You want to make sure their arm is completely relaxed, and you want to make sure their legs are uncrossed. You want them to be completely relaxed, no kinks in your lines. And then we just press the start button. You want to make sure there is a calm environment, no reason for their blood pressure to be high. They should not be talking. No one should be externally stimulating them to get the most accurate blood pressure. The blood pressure cuff is squeezing her arm, and then it slowly deflates, and it's checking for the first thump of the arteries, which will be your systolic, and then it's checking for the last thump, which will be your diastolic. And right here we have a great blood pressure, 126 over 68. That's well within the ranges of good blood pressure. This was the easy part. Now, we're going to do an automatic blood pressure. And for this, you need a stethoscope, and you need a manual blood pressure cuff. A blood pressure cuff will look like this. it will have a gauge, and it will have a pump. And so for this, you're gonna pump, pump, pump until you think you've gone high enough. If you believe your patient has higher blood pressure, you wanna pump a little bit higher than what you believe them to be. If they are normally of regular blood pressure, you'll probably just pump to about 140, okay? And the same rules go here. You want to make sure that your tubing is towards the inner parts of their elbow. And then you want to leave this spot open so that you can watch the gauge. So you put on your stethoscope. Make sure if your patient is an adult, you have it on the adult side and not the pediatric side. You take your stethoscope and you put it as far into their inner elbow as you can. Make sure you have a good look at the gauge. Make sure your pump is locked to where you can use pressure and the air will not escape. And you go. And you release the air pressure valve. And the reading that I just got, 124/76. So compared to 126/78, not too bad, not too bad. It's genuinely more accurate to do a self-manual because you know exactly what you're listening for, and the machine can make all sorts of mistakes. So, especially in a dialysis clinic where I work, we always have to double check our unusual blood pressures with our manual cuffs. And all the same rules apply to a automatic blood pressure. You want to make sure your patient is calm, relaxed, no crossed legs, no crossed arms, completely untense, no external stimuli. You feel okay? No lightheadedness?
I feel good.
No dizziness?
No, ma'am.
Constipation?
Nope.
Need to evacuate your bowels?
No, ma'am.
That's a sign of low blood pressure, by the way. Constipation is a sign of high blood pressure. Dizziness, low blood pressure or high blood pressure, shortness of breath, chest pain, also signs of high blood pressure, or hypertension versus low blood pressure, which would be hypotension. Thank you so much for volunteering, and thank you for listening to my speech.